So, what's today's date? July 9th? 10th. It's July 10th, 2022. If you hear music in the background, that is because what just
We're
happened?
celebrating. We just finished our first UGHE Babson Hackathon.
Let's explain what that means. Let's take it apart. Our location right now is in the country of Rwanda. And do you want to explain UGHE, the
Just
university?
take a moment. How about you take a look
Actually,
at the
that's
environment?
true. Yeah, before we talk
So
about where
where my finger is pointing is actually the border of Uganda. So we're in the northern part of Rwanda. This place is called Butaro. And where the sun is right now, you can actually see kind of part of the volcano. That's Mohobora volcano.
Is that the one that blew up?
It's still an active volcano.
It's still an active volcano. Is it the one that's on the Congolese side?
No,
of the border?
the Congolese side is way.
Wait. So we're safe here.
Yeah, we're
Anyways,
safe here,
let's
yeah.
talk about our location. Let's talk about who we are speaking with today. This is UGHE. That's the University of
Global health equity.
Global Health Equity, and we'll talk about the mission and why it has that name. Your name is Dr.
So my name is Rex Wong, and I'm the director of the Global Health Institute at UGHE.
Now, Rex is being humble. Is that what
I
what
wouldn't
you
say
use?
that.
He left out his title, which is doctor, and what other titles do you have?
Oh, so I'm an associate professor here, and I'm also the chair for the Innovation Center at UGHE.
And you were also a professor at Yale Medical School,
I was adjunct faculty at Yale.
and you've worked in how many countries?
I have been living and working, well, I've been living in 14 different countries and working in about, I would say 30-ish.
Okay, and that includes places like Liberia.
So Liberia, if I can count all 14. So Liberia, US, of course, Panama, Trinidad Tobago, Ethiopia, Tanzania, Egypt, Rwanda, Australia, Saudi Arabia, Qatar, India, South Africa, and Hong Kong, 14.
So, in other words, we're talking today with somebody who's seen a bit of the world, and not just places that fall within a narrow range of parameters. You've seen a wide range of countries.
Yeah, I got the privilege to actually live and work in different countries. That's true.
And so, if we're collecting stories of extreme entrepreneurship, people that have made something new work in an environment that doesn't always seem from an outsider's perspective to be conducive to a new institution, you would say that anybody
I
would
would
say
say it's wrong. So I would say the people say it's not possible to do without a lot of resources. That's wrong, because I think talent is universal. So everywhere you go, you will find people that are able to do a lot of things. There are also people they don't want to do a lot of things. So It's not about US, it's not about Canada, it's not about Rwanda, it's everywhere.
everywhere there are people with talent, ability, motivation. The point is, I was trying to phrase it carefully, to outsiders.
Yep.
Some of these places that you've mentioned
Yep.
are places that an outsider would think, oh, it must be difficult to do something new there. Would you agree?
Yes, it's difficult. So obviously, when you have places with not a lot of resources, it's always challenging. But the idea of innovation is, it's not always about resources. It's not always about building a new thing or setting up an app or creating a device. Sometimes it's just about moving things around, creating an engineering process, shifting workflow, changing your mindset. So a lot of this doesn't really cost money.
And let's talk about this latest institution that you've helped to build from the very beginning.
Yes, so UGHE was started in 2015, so I've been involved in UGHE from the very beginning.
And famously, the person who's most famous who's been involved is Dr. Paul Farmer.
So Dr. Paul Farmer is actually the founder of the university, and he was also the founder of PIH, Partners in Health. And unfortunately, he passed on 5 months ago.
Is it already
And it actually happened just right over there. And you see the number 2 over there, that's exactly where it happens. So he passed on campus while we're here, unfortunately, and it made a huge impact to us.
So why don't you now explain to somebody watching this who hasn't yet read about UGHE, why don't we explain why Dr. Paul Farmer founded this place? Was this the original place he wanted to found it? Why did it make sense to found it here? And what is its purpose?
Yeah, so University of Global Health Equity is always the vision of Dr. Paul Farmer. He wanted to provide free education for the people that they deserve to have education. And for those they normally cannot have the opportunity. So UGHE, the unique part of UGHE is we're a medical school, but we don't charge any medical school tuition. So anybody who actually wants to go to medical school and they have the talents to do it, we provide free education for them. Apart from the education, we also provide housing. You can see all the housing here. 3 meals a day. We provide internet, computer, stationary classroom. So literally, if you pack your bags and then come over to campus, and you will be able to focus on your study.
And this is true what you said, but not everybody can, because it's actually very selective percentage-wise. At a percentage of applicants, this is more selective than Harvard University. Is that correct?
Yeah, we're very proud to say that we are very selective. Now, obviously, we cannot compare directly to what Harvard is doing, but our admission rate right now, as of this year, we stand somewhere around 4 to 5%.
4 to 5%, and Harvard University, is it the medical school or the university on average to all the schools? Is 5%?
Harvard's just somewhere around the same.
Somewhere around 5%. Okay. Well, if anybody's watching this and is from Harvard or knows that is incorrect, please say so in the comments. Your engagement and corrections.
Please correct us.
Yes, your corrections are welcomed, and your engagement is welcomed. All right. So let's talk about lessons learned, because this channel that I'm going to post this on was created to complement my book and the book that's on the way. And who knows, there could be a chapter that profiles some of the lessons learned. From starting this place. So let's talk about your biggest lessons learned. If you had only 5 seconds left in this conversation, 5 seconds left to communicate something to people, anybody who's starting something new and is experiencing challenges, what's your biggest lesson learned?
So I would say mistakes always happens, right? So if we expect everything to be perfect, I will be lying to you and nobody would believe me anyway. So we just have to move on and make sure we learn from our lessons. And that's about UGHE, but that's also about any kind of global health programs. When you implement something, a lot of programs fail, and you will hit the bumps. But bumps on the roads are the road. So that's
bumps on the road are the road. So that's, if you want to get out of here, turn it off, and you want one lesson learned, that's it. The bumps on the road are the road. You mentioned global health in your answer. Do you want to explain what global health means?
Yeah, global health is an extension of what we used to be called international health. So as the world is going bigger and bigger, it's all about putting everything together. It's not just about US and looking at outside. What other countries are outside US? In the past, it's always very American focused. So this day, global health is about really global. So US is part of the problem, part of the system, and part of the solution. So if anybody's trying to go into the global health in this field, don't think that you have the answer, because you're the answer, but at the same time, you're the problem.
Why are we the problem?
Because we are part of the whole system.
Well, what's wrong with the system? It's not fair. It's not equitable.
Yeah, well, that's why we have the University of Global Health Equity, right? So equity is not about everybody being equal, being the same, but it's about whoever needs more help, we're providing them help in a way that is equitable. And it's also meaningful. So it's not always about just giving you money when you need money. It's about giving you the need that you need and generate meaningful outcome. Not in a demeaning way, and also engage you in an equal partnership.
Right. So, to clarify, some people say take issue with, oh no, they're talking about equal outcomes. We're not necessarily talking about equal outcomes like full on everybody gets the same amount, universal same income. We're talking about essential life-saving services, that there shouldn't be a difference between somebody where I teach in Wellesley, Massachusetts, and somebody here in Rwanda in terms of access to life-saving services. Right. Is that correct?
So the idea is, it doesn't matter what races you are, where you are in the world, is your life is equally important than mine, and just like everybody else. So if there's a way that we can save life in the States, they should have the same mechanism to achieving that outcome here.
So the two programs that I'm familiar with, and you probably want to add more, is my understanding. Right now there's a medical school for people primarily from Rwanda. Instead of going to what we call undergraduate in the United States, they go straight into 3 years of medical school here? Is that right?
6.5.
6.5.
So actually what they do here is in Rwanda, they come out directly from high school and then they come into the medical program. It's a 6.5-year program. And when they get out, they actually get a bachelor in medicine program as well as a master program, because it's a dual degree program. So the second program we have is also the flagship program at UGHE. This is called the Master of Science in Global Health Equity, which is under the Institute of Global Health. And in this program, we have right now 44 students with 3 different concentrations: One Health, gender, sexual and reproductive health, as well as health management.
And so those people will go into administration and are not necessarily going to be practicing doctors. The practicing doctors come from the medical school.
Correct.
Okay.
Yeah. So the graduate from this program can go from NGO, World Health Organizations, any kind of UN divisions, or they just want to work in a small local NGO or work in the government, going back to the home country, work in a hospital, anywhere they want. The essence is about leadership. We're focusing on training people to be good leaders so that they can implement changes in the global health arena.
So now that you mentioned leadership, what are your number 1 and 2 lessons in leadership? You now run a staff of how many people here?
So we have about 150 students on campus, and then another maybe 100 staff on campus.
100 staff, and that includes
Security, gardening.
Security, we should say, even in a very secure country.
Yeah, we have a lot of security here, because we need to promote job security for people. Cleaning staff, kitchen staff, and all the other staff supporting the program.
So you manage people, and what are your lessons for other people who need to manage people? Hiring and firing?
No, I think they
rules?
manage me. Actually, we need to treat the staff equally, and then make sure we empower them, give them the freedom as well as the opportunity to fail, so that they can build themselves up based on the lessons they learn.
Now, to somebody watching this who might be skeptical of anything that is in any way furthering justice and equality and equity, they might find it very intriguing that you took an idea that comes from entrepreneurship and business schools, where we normally teach for-profit thinking, and you're applying it here in the health context. Do you want to explain why this first hackathon, supported by Babson College and Dr. Wilgina Glover, hello, shout out. Dr. Glover is down there celebrating with our students while I torment you with questions. What was the goal? Why did you adopt this, borrowed from the for-profit world, from the entrepreneurship world, a hackathon for your school that tries to provide equal access to healthcare?
Yeah, so over the years, a lot of money has been pumped into all this low middle income country, right? And then a lot of studies have been showing that the economy of the country is not doing much better. And then over the years, there are a lot of programs implemented by different NGOs, and then a lot of them they fail, including some of mine, right? So traditionally in global health, people don't talk about money because a lot of them were sponsored or donated by people. And making money is probably the last thing people have in mind. But over time, we learn something. If we don't consider money not being a responsible, holding ourselves accountable in terms of spending, we're wasting people's money. And this money are dedicated to donated by people and dedicated to people that need help. And when as a person being the middleman, and if we're not handling the money in an accountable way or responsible way, we're not doing global health equity justice, and we're wasting people money.
So you wanted to find solutions that are effective, that don't waste money. Yeah. Do you mind talking about your story, the evolution of the campus, building the school? Again, might write a book chapter profiling how this place was born. So Paul Farmer originally wanted to do this in Haiti, didn't he?
He still has the idea of doing it in Haiti. Actually, It's not just about Haiti and Rwanda. It's all about, his vision is every single country should have a University of Global Health Equity, a campus there. So UGHE is only the first one. And then we already have a campus starting to develop in Haiti right now.
So this is a theme. There are a few chapters in my first book about these great ideas, awesome model projects that lasted 40 years, but they weren't replicated. What do you think is the limiting factor? What will be difficult in setting this up like a package of intellectual property that could be copied, or taking like a franchise model? Could that work? That you just package the IP, find a local partner, and say, here's the instructions?
Well, a certain part of it's definitely packageable, right? So obviously, all the curriculum that we have, the way that we deliver the education and services is definitely replicable. Is it an easy way to do it? No, because we rely on a lot of resources, a lot of donors, a lot of people who are willing to do this work. But I think the most important thing is they're actually finding the right people to deliver the job, because obviously this model is not for everyone, right? So a lot of NGO world, a lot of global health world these days, the buzzword is about sustainability. So we talk about free education here, we talk about free services here, we're providing housing, everything for free here. So the resources that we have to put in obviously is a lot, and we're not going to lie about that, right? But one famous quote that I'm going to quote from our founder, Dr. Paul Farmer, is life is not sustainable. So if we keep talking about whether this model is sustainable, are we generating enough money to make it work? And we're forgetting about the most important component. It's about human life. What we're here to do is to make sure everybody got what they deserve, get the best health they can.
And I guess I'm not over disclosing, I'm not revealing something new. This is apparently, he was very public about this, that this should not be dependent on generating profit. Human life
Human life is not about profit.
should not about profit.
Not about
And so were there others in the public health arena, in the world of either thinking or doing this work, that argued that no, we need to find a for-profit model, otherwise it won't last? Were there others that took the opposite point?
Oh, there are a lot of NGOs are doing that, and then I also think they should. Right? It's not about one model that only works. It's all about like a combination of different models. If your organization is about finding a sustainable way to help countries to build system, that's your area. And then we are here to serve the people they normally would not get the service, and then we're delivering what we need to deliver. So there enough space in the global health for everybody. So if your organization's the model is about making sure system, we're setting up the system, we're taking care of the majority of the people, that's fine. We're here to take care of the minority here.
Okay. So the challenge to scaling, the challenge to replicability, do you believe there's enough money in the world, or is it a question of finding the right people?
Both. Money definitely is that's enough. I mean, if you look at the wealth of the top 5% of the world, right? The money is definitely more than enough for people to
This is what people
spend, to distribute, right?
This is what people say. If you,
Yeah, it's
there
all
is
about
money in the world.
distribution, right? If you talk about not just money, food, there's never a shortage of food in the world. It's always about the distribution of food. Supply, there's never a shortage of supply. They're always coming from somewhere, right? And COVID-19 is an example. Vaccine, do we have a shortage at the beginning? US got way more vaccines than we need for the entire country. So it's never about a shortage of any kind of items. It's always about the distribution. So the equitable distribution, and that's what we're here for.
So we covered that big question. What's the limiting factor to scaling? It's not money, it's going to be the right people.
Yeah.
And getting that money to be allocated for something
Yeah,
like
I would
this.
believe.
Okay, now the history of this place. Ground was broken. Actually, when was site selection?
Site selection, I think it's early 2015. Breaking ground, it happened in 2016.
And you were approached by Dr. Paul Farmer in what year?
So I started working with UGHE part-time when I was still working at Yale University in Rwanda, and I was teaching.
I'm smiling because I know what Dr. Paul Farmer did when he approached you. Do you want to explain?
He
Were you in front of
did.
students?
He was. So Dr. Paul Farmer, who was a very interesting person, and he's a very approachable person, and I'm sure. I'm telling this not because I think I'm any superior than anyone, but just because Dr. Paul Farmer, he's such a humble person. I remember one day when I was teaching the class in Kigali office, and he just walked into the classroom and he knelt down in front of all the students and asked me to join the UGHE. So I could not say no.
He got down on one knee.
On one knee. He almost like he was proposing to me.
Exactly. Really quick aside, I'm going to share my one interaction with him. I'm going to cut out all the details and just say this. My lasting memory is that he had an intensity about him. It was like his eyes just, that energy was contagious, and you didn't forget the sense of mission. That this has to be solved now. It should have been already solved. There shouldn't be people suffering unnecessarily in the world. I wonder, since he was the founder, is there another lesson that you've learned about leadership, whether it's just charismatic leadership or any other qualities that he had? What made him effective? What made him able to challenge to channel the resources, to get the resources and focus the human talent and the money on a problem?
Yeah, I think one thing I learned from him is like he knows what he's doing, and he's very focused on that. He's not talking about money. He never care about that. He never care about the time. If the patients, if the students need his time, it would be midnight, it would be early in the morning, and he will take care of that.
Okay.
Yep.
Is that commonly known? Is there anything else you could offer that maybe hasn't been already written about him? Is it all out there?
I think it's all out there. He's a very famous person.
Yeah.
But he has a very good sense of humor, and then three things that I think he loved most than anything else. One is taking care of his patient.
Okay.
Two, taking care of his students. He loved being around his students. And then number three is gardening. He loved planting flowers, particularly roses. It could be wrong, but it's flower, definitely.
There was a story I heard from people in the local museum that when ground was finally broken, there's a tradition here locally in Rwanda that you don't take down the big trees, that the big trees have some kind of meaning. And they said that early on somebody didn't realize this, and I'm wondering which tree that was that they tried and they realized, oh, no, we got to leave that in place.
Right.
They have like some kind of spiritual meaning. Is it that big tree over there?
That's the one over there.
I've been wondering every morning. Okay, so do you want to, is there an allegory, is there something to learn from that little story?
Yeah, well, I wasn't here to actually know the whole story, but one thing about that is we could have easily cut down the tree without the tradition, right? Or the Rwandan belief. But Paul Farmer, he believes animal, human beings, the environment, they should all deserve to have the right equity, basically. So the tree is beautiful, and he loved gardening, as I said. So instead of killing the tree, we actually designed the campus surrounding the tree. So it's pretty amazing. The tree is still there. If we can walk over there, you can actually see the whole tree.
I'm meanwhile switching hands because my right hand has gotten very tired.
And that's the tree.
All right, I'm gonna go on this side now so I can hold my cell phone with my left hand.
And that's the biggest tree on campus.
So let's take that in. And so there's a lesson here in design if you're ever building a new institution physically, to maybe respect the local geography, take it into account. Don't take the approach of erasing everything and just annihilating what's there. Build with the local culture, build with the local tradition, build with the local landscape.
Yeah.
Maybe that's it. Anything else? So ground was broken. You're hired to be a director here.
For the Institute of Global Health.
For the Institute of Global Health. Why don't you take us through the early challenges? What were the biggest challenges when this place was being built?
So very, very early challenges. Obviously, the physical part is like when you build any kind of physical building, always there's something's wrong, right? It's water leaking, the noise is too much, it's too cold here. There are a lot of things that we cannot actually control. But I think communication and actually working with a team is the most important thing. As I said, there always be challenges, regardless it's about the campus or about any kind of global health programs. You will never get it right the first time.
Never get it right the first time. Advice about working with government and rules and laws.
We just have to respect the government and the rules and laws. So a lot of times, I think one of the biggest challenge a lot of over this year, I've seen a lot of people make, particularly if they're coming from other countries to work in global health arena. The first thing they said is like, this is not how it works back home. The moment you said that, you have to catch yourself and take a step back because you're not home. So you do have to respect what's going on here. And whatever brilliant ideas you think you had is probably not new. People probably have tried it, probably have thought about that, and it didn't work for a reason. So don't expect you come in and have a solution and then say, if it's not working, it's because it's your fault. That's not the case.
You've tapped into a few lessons there that we can quickly use to wrap up this whole interview. So, organizational form. Was there any doubt about what kind of organizational form to take? I mean, you're incorporated as a not-for-profit organization in Rwanda. There was never a dispute about that. Or was there any decision? All right, you just mentioned ideas, that if you have an idea, it's probably not that unique. Somebody's probably had it, it's a question of execution.
Execution and support.
How would you feel if somebody completely copied the blueprint here? One of your former employees.
Well, I think if anybody wants to copy the blueprint, by all means, because that's what global health is about, make the world better. It's not about hiding the intellectual property right. If you find a better way to make sure education is equitable, health is equitable, health access is guaranteed to people, by all means, copy, make it better, and we're more than happy to collaborate.
Okay, so the problem is big enough that there's room for plenty of people copying.
Even in the States, you have problems there.
Contracting. What are your lessons about making agreements? You must have dozens of contracts for things like food, medical supplies, both local and international. And you mentioned something about negotiating yesterday. I forget what context. I think it was suppliers. Anyways, or it might have been this morning at breakfast. The point is, what do you have to share to anybody watching this about negotiations and contracts?
Contract. I think contract, if we're talking about hiring people in the organizations, definitely try to hire as many local as possible because they are our local connections, and they are the capacity that we're here to build. As an expat working in another country, at some point we all know that we're leaving, and they should kick us out at some point, right? So the people in the country, they actually have the solutions. They may not have the skill as of this moment, but that's why we're here for. So if possible, hire as many local staff as possible and build a capacity and make sure they replace us at some point.
Okay.
Yeah.
And that's an interesting answer. I thought there would be something more about when negotiating how to get a reasonable deal if somebody is being too demanding from you.
Yeah, well, I mean, that happens all the time. I don't have a solution for that.
You don't have a solution?
I don't have a solution.
You just
for
explain, look, here's my limit, here's my budget, I can't do more.
Right. I mean, that's pretty much the business model that can be applied to all kind of programs. I mean, you have to negotiate, and then you have to make sure the people you're trying to benefit from the program actually get the best deal.
Okay. Remaining topics that sometimes come up in these cases, liability issues. Do you ever worry that something that you do here is going to hurt somebody? I mean, actually, anytime you work with a patient, there's a risk of loss, a risk of causing more harm than cure. Do you guys do anything to control that risk? Is there a risk of liability?
Definitely, no, absolutely. Anything we do is actually a liability because if we take the job seriously, every single life, every single person we're responsible for, right?
Yeah.
And
we should point out where the local hospital is, actually. Do you want to walk this way and point it out?
So if we are not taking liability seriously, that means we're not actually doing the population we're trying to serve justice. And one thing we need to do is obviously we need to make sure every single person working in our organizations, they understand what we're here to do. We're not here to make sure our resume is good. We're not here to make a lot of money. We're here to make sure the people we're serving get the treatment that we want. So over the years, we have seen a lot of doctor, nurses, or other people coming over here, missionaries, they come over to different low-income countries and say, oh, I'm here to save life. I'm here to help the country without knowing what's going on. So sometimes we do a lot more harm than good.
That's interesting.
So that's very important. And only because you can practice in the States, you have a license in the States, doesn't mean that you know how to practice medicine here, right? So you still have to understand the local culture. What is the limitation? And if you think you're always better just because we graduated from the States, and you guys are so lucky because I'm from Yale, I'm coming here to save you, so you should listen to me, and that's always wrong. And I made a mistake when I was younger, and I've seen a lot of younger people when they first come to the country, they made the same mistake. And I caught myself saying this multiple times when I was in my younger age, saying, oh, this is not how it works in the States.
Yeah.
And you do have to understand this is not the States anymore. And there are limitations here, there are restrictions here, and there's local culture that we have to follow, and we have to understand why things happen. So if you do not understand and pretend that you do, most of the times you're doing more harm than good.
So I want to, first of all, validate from another source what you're saying. There was somebody who just finished her master's in public health who coincidentally was in Kigali. I asked for one big piece of input before the hackathon from somebody from Johns Hopkins, I think it was. And she said stakeholder engagement. Stakeholder engagement. Whatever
it almost sounds like a buzzword, right? Everybody's talking about that.
But it means being humble enough to ask questions and listen and realize that your approach to something might not be the approach that works everywhere.
So every single organizations, they talk about stakeholder engagement. At least they put that in the report, right? But what we're here talking about is actually meaningful stakeholder engagement. So in global health work, there's this kind of unbalanced power dynamics. Whoever got the money, whoever got the funding, sometimes has the most power to talk about what we want to do, right?
Absolutely.
But that's not a meaningful engagement. So meaningful engagement is talking to the people, ask them what they actually want to do. And that's why we have this hackathon this weekend, because part of what we do is like, what do the customer want, so that you can develop something that they can use. The
patients, the doctors, the hospital administrators,
and anybody who is benefiting from the program. So if we don't ask them and assume that what we want to create is what they want, it's not going to work. That's huge. The example I gave my student here is, I'm an amazing cook, I can make chicken. Only because I make an amazing chicken dish doesn't mean that the vegetarians will eat it. And that's the story I have.
Let me give you one piece of pushback that I could imagine somebody thinking. The human body is the human body. We're one race. And if you learn biology, anatomy, and how to cure a sick person in New Haven, Connecticut, that knowledge should be just as valid here for curing a sick person. So what do you mean? What could be incorrect about your Yale Medical School methods here in Rwanda? What could not work here?
Well, I'm not talking about the medical technology or the techniques or the treatment. Treatment is treatment, right? There are a lot of medical treatment that is with a slight modification, it works. I'm talking about the local culture, the
Bedside manner,
how
a hospital is run,
the social determinants of health, because health is not just about the medication. There are a lot of other factors influencing health. Poverty is one of the biggest factors. You will never be able to understand poverty until you're actually with the people. And I've been living in Rwanda for 12 years, and I don't pretend to understand the local culture completely. Obviously, I'm not living in the poverty here.
Right.
So just saying that I understand what they're going through, I'm pretentious and arrogant. And I think we all have to keep that in mind and be humble about that.
So what are you doing to make sure that you reach out? Like I really don't want this to sound like this is authentic engagement, but I went running this morning, and when you go running and you see people in the early morning, what they're doing for work, what the kids are doing, you begin to get a sense of the rhythm, just a little bit of a glimpse. What do you do to get authentically people more into the mindset and live the life? I mean, do students and staff and you, what do you do for that stakeholder engagement?
Yeah, so in a more general term, so if you have specific projects, then obviously you have specific stakeholder engagement, right? But in a more general term, UGHE, like many other universities, we do three different things: education, research, but the most important part is the community engagement. We emphasize that a lot. So when we say community engagement, it's about actually trying to get into the community. So before COVID, we had to stop a lot of things, but we send students out to the community, send them to a high school to teach kids after school programs. We opened some adult learning program on campus. We invited people from high school to come in to play basketball with our students. And every now and then we open the campus, and then we invited people to come in from the community.
And the medical school students have to teach in the hospital. This might be the moment to point out where that hospital is.
So if you see, it's a little bit getting dark right now. So right over here, that's the doctor's housing. And if you just follow that a little bit, where my fingertip is, and that's where the hospital is.
And that's
where a little bit expansion right now.
And Dr. Paul Farmer, right up until literally his last morning on Earth.
Yep, he was still at the hospital with the patients, with the students.
With the students and the patients in the hospital.
Correct.
I'm pausing to let that sink in. And the last few points, are we getting summoned to go to dinner? I think we're getting summoned. No. Okay. If we only had 10 seconds to wrap up, the themes that I wanted to double check with you that other people have mentioned about starting something new in an environment where maybe not everything is familiar to you, let's put it that way, because Rwanda is fairly stable. They say start, don't wait, don't overplan. Do you agree?
To a certain extent, yes, because you will never know exactly what will happen. So if you don't do it, just keep waiting. It's almost like people always say, you will never be ready to have kids until you have kids.
Yeah,
so
and you're still not ready once you have them.
Once you have kids, you're still not ready. You still have a lot of challenges. So I think that's the lessons we have learned.
And then the other recurring theme is share. Your idea is not that unique, and it's only by sharing. Maybe you want to be strategic. You got to share something about what you're dreaming of doing to get the people to come out of the woodwork, the serendipitous discoveries of people that want to see your dream come alive. And that is a lesson of both of Dr. Farmer's life and of yours. You agree?
And also the lessons learned from the hackathon.
Right.
People have idea, but not too many people execute it.
Right.
So, and then if you have an idea, you don't share, people will never know. And then even if they want to join you, they will not know otherwise.
And relationships. I think here's maybe the last one where I could tie in some of both your own experiences and Dr. Paul Farmer's. Any tips? Do you ever watch him start a relationship from scratch? Were you ever in the room when he walks in, shakes hands?
A lot. And this is one thing Dr. Paul Farmer did really well. Even though you met him for the first time, he can come into the room and make you feel that you have been his best friends forever. That's his ability.
You seem to have picked up that ability. I feel like I've. Like,
Oh, I hope so. I certainly hope so.
Well, no, I know this is. I'm not like just flattering you because this is on a recording, and I want to maintain a relationship between our institutions. I authentically feel like from our interactions, even on video, like you're somehow radiating. You're a buddy. You're a friend. You're an ally.
Well, there's no point to make enemies.
Right, and so basically the secret, if somebody is not naturally from a culture or doesn't have the personal predisposition to build relationships quickly, to build rapport quickly, is the number one thing that you learn from Paul Farmer to basically assume this person might share my passion, and just assume, because you say that from the moment he made people feel.
I think
like
we shouldn't be assumed. We just believe people are good in nature.
Okay.
Yeah, and whether they share the your same ideology, maybe a different story. But by nature, people are good. So I think that's the foundation of it.
Assume people are good if you have trouble building relationships. Anything else that he did? What about follow up? You meet somebody, okay, he's whatever word you want to use. He acts like your best friend. Makes you feel.
And he remembers you.
And he
remembered you.
Any trick? Did he ever teach you a trick for remembering
No,
people's
I wish
names?
he had. No, I
Did
had.
you remember? Did he remember people's names?
For
those of us who have bad memories.
I'm terrible with names, actually. Sometimes I still can't remember my students' names.
Okay, that's
I'm really bad at that.
Okay, what about this? Follow up. He meets somebody, whether it's a patient that has nothing to give except the opportunity to help, a mega donor who could sponsor half this campus. What would he do as a follow-up, and how soon would he do it?
Oh, immediately. He follows up. And big donors, obviously, everybody follows up, right?
Right.
But for him, if there's a student asking for some kind of connection or asking for some kind of information, he will connect you with somebody else. He would. Yeah, he did it immediately. So he's very good at that.
Okay. Man, it feels like there's got to be a treasure more of lessons learned in building this place that you're just not divulging. You're waiting for the right question.
I am not sure exactly what the trick is. I think you just have to be here, stay longer, and experience the magic here.
Thank you for the invitation. It's now recorded, and the invitation is accepted. I do want to stay in touch. Maybe we'll talk a little bit more this evening or tomorrow morning before we leave.
Yep.
Lessons of the hackathon, any surprises, or was it all kind of like what you expected?
No, I have students, they did really well, and I'm sure you agree with that. And we just did a weekend of hackathon. I mean, it's a weekend, but it's only like a day and a half. And they came up with some amazing idea, and we hope we can develop the projects.
That's right. Some of them are, it should be said, some of them are imagined to be not-for-profit public health measures. Impact-oriented. Some were imagined that they would generate revenue from users enough to be financially self-supporting. So if you're watching this and you're wondering, was the hackathon just about ideas?
Let us know and then contact us. If you want to sponsor us, please do.
We end with a sponsorship pitch.
That's right.
Well, look, sincere, huge thanks. If anything more comes to mind, let me know so that we can record it and share it on this YouTube channel or wherever else I decide to share this. And let's do one more pan around here of the vista. Anything else you want to tell us in parting thoughts as we pan around here?
So
from
we
the
start
old
with
tree,
the big tree.
The big tree.
And the Ugandan border.
The Ugandan border, that beautiful hill in the mid-distance. By the way, you're seeing villages where basically, do people do subsistence farming? It seems like they have cows, sheep.
Farming is a big industry.
How many of these people actually sell in some nearby village, and how much?
We actually 80% of the food we consume on campus, we buy from the neighborhood. That's the idea of it. So what you're looking here right now is the housing of the university.
One more time, number 2, that's where Paul Farmer lived. His apartment is over on the left side. It is becoming a bit of a memorial these days, appropriately so. Anyways, number 2 over there.
Yeah, so all you see over here, 1 to 5, the residential housing, and then on the left,
there's the library there.
There's the library and then all the academic buildings.
And this is fully equipped, by the way. If anybody's wondering, was that a real medical school? We did a full-on tour, and there's everything from, there's lab,
internet, sim lab, laboratory, classroom, teleconferencing capacity, basically anything you need to be as a classroom.
If you can get somehow in here, if you have the metrics that it takes to get in here, this is an amazing fully equipped med school. That's a challenge to those who are pre-med.
Global Health School.
And Global Health School. And you're about 2.5 hours, if the roads are good, to the capital.
Yep. So we're 2.5 hours away from the capital city of Kigali.
And the reason it's located in the rural countryside, if I recall correctly, and not in a city, this is part of Paul Farmer's vision, is to get access to healthcare, including to the subsistence farmers of the world.
And to develop the community. So we're here because we want to develop the community.
Right, and not just sit in an ivory tower in a city.
Right.
I don't know, it's not even, I mean, it is a bit white, but it's not an ivory tower.
Yeah.
We actually
no
are.
Here.
Well,
there
actually is an observatory, but we have not gone into the ultimate ivory tower there, the observation. This is, so to take it back to the mission here, we're in the countryside because he wanted to expand access and do community development. It is engaged with the local community. Oh, and if anybody's thinking, oh, well, there's nothing interesting around except for villages. No, first of all, it's gorgeous. I hope we illustrated that. And
the interesting part is the village.
There's a little cultural museum. Why is the village interesting to you, by the way?
No, because there's just, what's not to like? Just look around. So this is what global health means. Right. We're not sitting in the office of some of the big city. Yep. That you can do anywhere. Right. We're here to experience the rural health. We're here to experience what the underserved population means. People always say that we're in the underserved population. Mm-hmm. We're helping them, but many of us, when we're doing this kind of work, we're actually sitting in our own office in the comfort of the air conditioning and internet and computer, doing our research. But this is the life experience here. Yeah. Our student coming over here, no matter how hard the program is, how much homework they have been doing throughout the program, at the end, the consistent feedback we receive from them is totally worth it because of the experience.
Yeah. And I would agree, based on my short experience, this is going to sound cheesy. I would say authentically it was spiritual and magical. There were moments that I will never forget, including
glad you feel that way.
What you shared about Paul Farmer's legacy last night was unforgettable. There was an atmosphere, a mood, especially, I agree with you. It's hard to put your finger on it. It's hard to explain why it's magical to just hang out and be around these villages where the pace of life is so different. Yeah. And anyways,
maybe you can do some interview with some of our students and see how they feel.
That's not a bad idea. We might add that. All right, look, if we come up with any major revelations, I'm sure that Dr. Rex Wong is full of them, and I just haven't asked the right questions to crack open the treasure chest of further secrets for extreme entrepreneurs.
Oh, wow.
The aspiring, the practicing, but hopefully this video interview has been interesting. If you already know about Paul Farmer's legacy, hopefully there was some little additional wrinkle that we could provide to your knowledge, and if you are not familiar with it, hope this has been an interesting introduction to UGHE, Dr. Paul Farmer's legacy, and the work of Dr. Rex Wong and team here. And with that, we're signing off.
Thank you.
Any final word? Final word is yours.
Come visit us.